Workload management and athlete monitoring. Sports injuries are a huge problem. In the United States, 1.5 million high school and collegiate athlete injuries happen per year. In the United Kingdom, sports emergencies account for 390,000 emergency department visits per year. 38% of professional soccer players experience mental health issues. 38% of professional soccer players reported experiencing mental health issues. 13% of the general population also experienced this. More than 60% also had more than one severe joint or muscle injury at the same time. Injuries that result in decreased match availability impact negative team performance. Injuries are not just a result of bad luck. Players' rating of fatigue and sleep quality are significant predictors of injuries. Fatigue contributes directly to anterior cruciate ligament injury. Football players are 3.19 times more likely to get injured during weeks when they had higher academic stresses. And unusual increases in training loads were seen during the week prior to injury compared to that of the 4 preceding weeks in research studies. What we're seeing is fatigue is a key factor to injury. Fatigue results in decreased decision-making ability, decreased coordination, decreased neuromuscular control, and possibly an increase in risk-taking. All of these things can result in injury. The problem is simple. The load ends up exceeding the capacity of an athlete. There are two things that can happen. One, an athlete is psychologically or physically unfit to tolerate a prescribed workload. Or two, an athlete is physically fit but is in need of rest. A great example of this is the defending World Cup ski champion, Laura Gutt, when she tore her ACL. We see this all too often when athletes are training for extended periods of time. Their ability to adapt to that load is dependent upon their ability to adapt to those stresses, and it depends on how long they've been training and their overall mental and physical state of well-being. There is a reduced ability to adapt to loads and increased susceptibility to injury over a period of time. This is dependent upon the load and the amount of recovery time. Risk comes from many sources. Those can be from training or competition loads, competition schedule, training schedule, other factors, lifestyle and well-being, and from even previous injuries. Some examples of training and competition load factors include cumulative load, week-to-week load increases, high to low acute chronic load ratios, and spikes in loads. The competition schedule, such as the game to training ratio, lots of playing time, fixtures in congestion, and lots of travel. In training schedule, the number of hard days per week, or the weekly training monotony. And other factors, adequate warm-up time, poor fitness, nutrition and weight loss, the type of sport, early sport specialization, and the age of the athlete. And lifestyle and well-being, pre-game and training fatigue, poor sleep quality, high level of stress, and poor general health. In this, we need to focus on the factors that we can control. I've highlighted in the red boxes the factors that we can control. With all of these factors, we increase our risk. Some of these factors we can control, like the red boxes, and other factors we cannot. So how does load management work? Our goal is to decrease the risk and increase the performance of our athletes. We do this by monitoring fatigue, sport and non-sport, physiological and psychological stressors. We try to detect inadequate workloads, either too low or too high workloads, and we adapt, either decrease or increase the training program, recovery and rest based on an individual's response to training, fatigue, wellness, fitness, health, and recovery levels. What is load? Our definition of load is the combination of sport and non-sport stressors. There are external loads, the external stimulus applied to the athlete, such as distance, weight, and power. and an internal load, physiological and the psychological response to external loads combined with the non-sport stressors. Internal load is the trigger of training-induced adaptations. We can use tools to assess each of these loads. For the load or the workload, we can use questionnaires, session rating perceived exertions, and wearable technologies. To examine external loads, we use accelerometers, GPS, and dynamometers. To evaluate internal loads, we use physiological and psychological metrics. The physiological metrics include heart rate monitors and lactate levels that are gathered collecting blood draws. Psychological and physiological assessments can include session-based ratings of perceived exertion levels. Measuring internal loads. We can use heart rate to assess the internal load. The rationale behind using heart rate is that there is a linear relationship between the heart rate and the rate of oxygen consumption during steady-state exercise. The load should sum the scores for each of the zones. However, there are some problems with this assessment. Unfortunately, heart rate does not measure the psychological component of exercise. Heart rate fluctuates daily by up to 6.5% and increases the need for regular calibration of the training zones. Heart rate can underestimate the load during short-duration, high-intensity, anaerobic activities, so we need to be cautious with this assessment. It's not a bad assessment, and it is a cheap one, but it's just something that we have to be aware of. Session-based ratings of perceived exertion. The rationale behind using this metric is to assess loads. The difficulty of the session divided by the rating of perceived exertion on a scale of 1 to 10 multiplied by the duration or the minutes of exercise. The advantage is this combines a subjective and an objective measure. It can also validate for most of the sports and activities, the aerobic, anaerobic, and strength training, and across age groups. This is also pretty simple and it requires very little equipment. The problem is it requires athletes to enter and report data. Session reporting perceived exertion is a valid measure of internal load for a broader range of sport and activity. This is a rating of perceived exertion scale from 1 to 10. We can see 1 is very easy and 10 is maximum effort. 1 would be daily activities besides sleeping, something that we could do all day at a pace. 10 would be a maximum effort. We'd be completely out of breath and unable to talk. We would be exerting maximum neuromuscular power. We'd be performing maximum lifts or even sprinting. The key to workload management metrics. Key 1. Anticipating fitness, fatigue, and freshness. Our chronic load. There's 4 to 6 weeks of load average that's linked to fitness. For the acute load, 3 to 7 day load that's linked to fatigue. The freshness index is the difference between the chronic load and the acute load. There is a freshness index that is the difference between a chronic and acute load. Positive freshness index equals a low fatigue plus a good performance. There are some calculations in here that we need to look at for session load, daily load, weekly load, monotony, and strain. Key metric number 2, increasing load safely, avoiding spikes in load. Acute chronic workload ratios. We need to keep players in the high load, low risk zone. We also need to look at a week-to-week load increase. What percentage of load increase from week 1 to the next is safe? Our key metric number 3, ensuring adequate load distribution and volume. We need to look at monotony, strain, and even youth athletes. With monotony, fluctuations of daily loads within the week, or our daily mean divided by the standard deviation. Strain is the negative effects of heavy loads combined with poor load distribution, or load times monotony. We need to be cautious with youth athletes. The number of hours per week that they work should be less than 16. A good rule of thumb is that we are not allowed to work more hours per week than the athlete's age. So, for example, if an athlete is 12 years old, you should only be working that athlete around 12 hours a week. Key metric number 4, measuring the invisible. For the most part, we're dealing with self-reported wellness, identifying readiness, well-being, and fatigue-related issues. We need to be cautious with personal feedback and identifying motivation, stress, fatigue, and training issues. We also need to consider enjoyment with training. We need to determine the intrinsic motivation and persistence of our patients or our clients. If they're having lack of enjoyment, it may be associated with sport dropout, staleness, and burnout. We may be able to assess this with daily wellness questionnaires. You can see on this slide why students quit team sports. Things like they were not having fun, they wanted to focus more on student grades, or they had injuries that may have an impact on their ability to continue participation. Additional metrics. There is neuromuscular testing if you have the equipment. You can use things like a counter movement jump, and musculoskeletal tests can provide useful information about neuromuscular recovery and or potential injury. Heart rate variability can be tricky to interpret, but it may provide additional information. There can be large day-to-day variability, and it may not always decrease after heavy loads. This requires comparison with other signs and symptoms, and it needs to be interpreted in context with the training history of each athlete, along with the training phase and load and distribution. Load management in practice is simple. We can do this by planning a workload carefully. Increase workloads very progressively. Avoid spikes in weekly workloads, and alternate hard, moderate, easy, and rest days. Keep a minimum of at least one rest day per week. And then secondly, adjust daily loads based on an athlete's wellness. We can do this by reducing external loads during stressful periods. Life events and sports-related stress can have a mutual effect. What is the athlete's perceived fatigue? Assessing quality of sleep, monitoring general health and well-being, and assessing and being mindful of fun and enjoyment with training.